If your bunion hurts every single day, there's a good chance you've already waited longer than you should have. And honestly, that's incredibly common. A lot of people spend years trying to live around bunion pain. They stop walking as much. They stop exercising. They avoid certain shoes. They give up the hobbies they love. And many patients convince themselves it's not bad enough yet, or I'll just deal with it. But eventually, there comes a point where the bunion starts controlling your quality of life. I'm Dr. Lance Reeves, triple board certified foot and ankle surgeon, and today I want to answer one of the most common questions I hear from patients. How do I know if I've waited too long to have bunion surgery? First, I want patients to understand something important. Most people don't seek bunion surgery too early. If anything, most patients wait far too long. And the reason usually isn't because the pain isn't significant, it's fear. Fear of surgery, recovery, downtime, crutches, losing independence, or hearing stories from someone who had a difficult experience years ago. So instead, many people slowly begin adapting their lives around their feet, and this often happens gradually. Patients stop traveling as much, stop exercising, stop walking long distances, or stop participating in hobbies they once loved. And many people don't even realize how much their foot pain has changed their life until it's gone. When I talk to patients about bunion surgery, I always ask them to think about three very important questions. Number one, are you in pain every single day? Number two, is this interfering with your daily activities or hobbies that you love? And number three, have you tried and failed conservative treatment measures? If you're saying yes to all three of those questions, that's a very important moment. So let's break these down individually. First, are you in pain every day? Now, obviously, pain is a major issue, but what concerns me even more is when pain becomes something patients think about constantly. When every pair of shoes becomes a decision, every outing becomes uncomfortable, every vacation involves planning around your feet, that's when the bunion is no longer just a cosmetic issue, it's affecting quality of life. Second, is this interfering with your day-to-day life or hobbies you love? This is one of the biggest indicators for me. If this is preventing you from getting on the golf course, playing pickleball, exercising, traveling comfortably, walking with your spouse, or enjoying time with your grandkids, that matters. Because at the end of the day, the goal isn't just correcting a bunion. The goal is preserving mobility and your independence. And many patients don't realize how much they've slowly adjusted their lives around pain until they finally address it. Third, have you tried and failed conservative treatment? Now, I'm a huge believer in conservative care when appropriate. Things like supportive shoe gear, orthotics, padding, splints, activity modification can absolutely help some patients manage their symptoms. But if you've tried all of those things and you're still in pain, that's important information because it tells us the problem may no longer be manageable with temporary solutions alone. So, going back to the original question, how do you know if you've waited too long to have bunion surgery? Here's my honest perspective. If you're in pain every day, it's interfering with your life, and you've tried and failed conservative treatment, then from my perspective, any point after that is probably longer than you needed to suffer. Now, that doesn't mean surgery is automatically the next step for everyone, but it does mean you owe it to yourself to at least have a conversation and understand your options, because many people spend months or years living with limitations they may not have needed to accept. One of the hardest parts about bunion pain is that people slowly normalize it. They convince themselves, this is just part of getting older, or this is something I just have to live with. But pain that limits your mobility, independence, or quality of life matters. And the earlier patients begin learning their options, the better position they're usually in to make thoughtful decisions before the deformity progresses further. If you answered yes to those three questions, you may be in a good position to start talking about whether bunion correction is right for you. If you found this video helpful, make sure to subscribe, follow along on social media, or visit the website below for more information. And lastly, if you want to post a question in the comment section, I'd be happy to make a video answering that question.